Zone therapy has been used for thousands of years. Ancient cultures such as the Egyptians, Chinese, and Indians each have a long history with this modality. This is Dr. William FitzGerald. He was an ear, nose and throat specialist in America who was the first to document zone therapy practices in a book that he published in 1917 called Zone Therapy. He found that by pushing on different points of the hands, he could create an anesthetic effect on certain areas of the body. He used things like rubber bands, surgical clamps, and even combs and clothes pegs to exert pressure on parts of the hands that created specific effects on other parts of the body, like relieving pain and desensitizing the teeth for dental surgery, which is pretty amazing, really. He divided the body into 10 equal zones, with 5 on either side of the midline. This was further developed on by this German woman, Hanne Marquardt. She introduced the horizontal lines on the feet, which are also called transverse lines. Hanne also developed a more precise map of the foot that helped to show an order to the body, in conjunction with the longitudinal lines of zone therapy. It wasn't just these two that developed zone therapy though. Hanne trained others, such as midwives, osteopaths, physiotherapists, and naturopaths. Many of her techniques have been used and developed far and wide, and are still used in many countries today. This picture shows how parts of the feet are conceptualized with the rest of the body. So you can see that the big toes relate to areas of the head and the neck. The inner arches of the foot relate to the spine, and the heels correspond to areas around the pelvis and reproductive areas. Think of these areas as being pathways that are communication channels throughout the body. You may be wondering what this picture, provided with the assessment, has to do with anything. This is a reflexology chart. It shows slightly different mapping of the foot than zone therapy, with very specific areas relating to very specific parts of the body. So this highlights the difference between zone therapy and reflexology. They are not the same thing. Reflexology takes several years of training to master safely and effectively. It is used as a diagnostic tool and treats specific areas of the body, usually on people who aren't very well and require support to achieve their good health. Zone therapy is not used to diagnose. It does not work on specific organs and should only be used on clients who are in good health. If this is all sounding a little strange and you feel like you may not be understanding this clearly, don't worry. Check out the Reflexology Institute website for further explanation, and rest assured that there is detailed video instruction available through the online campus that you can use to practice as much as you need to. The majority of workshop time for zone therapy is spent going straight into an assessment of the zone therapy techniques, so be sure you are familiar with them all. I suggest you practice with real feet while you play the video instruction at the same time. Do this as many times as you need to feel confident in applying these techniques. You can also check out the Naturopathic College forum on the online campus for discussion, or get in touch with the tutor who oversees this topic if you have any questions. Have fun practicing the zone therapy techniques.